Hi everyone, welcome back to my YouTube channel, and today we are going to talk about pelvic inflammatory disorder. So let's start our topic with introduction. Pelvic inflammatory disorder is an infection of female reproductive organ including the uterus, fallopian tube and ovaries. It usually develops when sexually transmitted infections such as chlamydia or gonorrhea spread upward from vagina and cervix into the upper genital tract. Pelvic inflammatory disorder is a serious condition that can cause long-term complications if not treated promptly. Causes it include sexually transmitted infections like chlamydia and gonorrhea are the leading causes, and other infections that are non-sexually transmitted infection. Bacteria can also cause pelvic inflammatory disorder, especially after childbirth, miscarriage or abortion. Risk factors for pelvic inflammatory disorders include multiple sexual partners, unprotected sex, previous history of pelvic inflammatory disorders, and use of intrauterine devices. Symptoms of pelvic inflammatory disorder can range from mild to severe. Some women may not experience noticeable symptoms until complications arise. Common symptoms include lower abdominal or pelvic pain, abnormal vaginal discharge with unpleasant odor, irregular menstrual bleeding, pain during intercourse, fever and chills, and painful urination. Diagnosis of pelvic inflammatory disorder. Diagnosis involves medical history and physical examination for checking for tenderness in the pelvic region. It involves laboratory tests like vaginal or cervical swabs to detect sexually transmitted infection. It involves imaging tests like ultrasound or MRI to identify abscesses or inflammation. It involves laparoscopy, that is direct visualization of pelvic organ under use in certain cases. Complications. If untreated, pelvic inflammatory disease can lead to serious complications like infertility due to staining of fallopian tubes, ectopic pregnancy, that is pregnancy outside the uterus, chronic pelvic pain, and tubo-ovarian abscess, that is collection of pus in reproductive organs. Treatment of pelvic inflammatory disease. Pelvic treatment aims to eliminate infection and prevent complication. It includes antibiotics, that are combination therapy to cover likely bacteria. It includes hospitalization for severe cases, abscesses, or pregnancy. It includes surgical intervention that is rarely needed but may be required for abscess drainage. It includes partner treatment, that is sexual partner must be tested and treated to prevent reinfection. Prevention measures include practicing safe sex, limiting number of sexual partners, regular sexual STI sexually transmitted infection screening, prompt treatment of sexually transmitted infection, and avoiding douching, which can disrupt vaginal flora and increase risk. Prognosis of sexually pelvic inflammatory disorders. With early diagnosis and proper treatment, it can be cured. However, damage to reproductive organs may be irreversible if treatment is delayed. Women with recurrent pelvic inflammatory disorder are at higher risk of infertility and chronic pelvic pain. Conclusion of this lecture video. Pelvic inflammatory disease is a serious infection of female reproductive organs, most often caused by ultrasound and untreated sexually transmitted infection. It can lead to infertility, chronic pain, and ectopic pregnancy if not managed properly. Early detection, antibiotic treatment, and preventive measures such as safe sexual practices are essential to reduce risk and protect reproductive health. And this is all about pelvic inflammatory disease. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.